He argued that the primary impacts came from improved nutrition and improved sanitation and improvement in living conditions and reduction of crowding. And so he gave an environmental or a public health and prevention interpretation of the change in mortality. Years later, epidemiologists and cardiologists and nutritionists and others met to contemplate what were the reasons for the decline of mortality from coronary heart disease in the United States. This graph is from a conference that was held in the late 1970s. Coronary heart disease mortality rose in the United States up until 1968, and then it began a precipitous decline. And they also took up this question of the role of medicine. And they tried to partition the decline into the components you see here. Various medical interventions, treatment of risk factors, changes in smoking and diet, and so on. And what I would note is that this is a modern version of the old argument that McCune was dealing with. And the doctors, the physicians there were saying, well, the CHD declined because of us. And the epidemiologist said, no, CHD declined because of us. This was we'll take more funding. So the argument's over basically risk factor screening and those sorts of individual preventive measures versus medical interventions. And so the arguments to this point have been about primary arguments over the changes in mortality rates, but really the causes of population health have been about medicine and about things that professionals can do to change the world so that we will be healthier. And they're fighting over resources to continue their work. And their work is very important. But what I would question is it an accurate historical account? And I would point out that none of these scholars have investigated the role of the anti-slavery movement, of the women's movement, of the civil rights movement, of the labor movement, of the environmental movement, and all of the other popular movements for social justice and environmental quality. So basically they have taken agency onto themselves for all these improvements. Notice they're not doing a similar thing with increasing cancer rates, saying who takes credit for that. But my point is that as academics, we have been fighting over responsibility and taking credit, and we haven't looked to the fact that people are not so ignorant as to realize that their children shouldn't be working 12-hour days in mines, which was legal and not that uncommon in the 19th century. Or that people need clean water, or safe food, or uncrowded living conditions. They need enough pay to be able to get by. And so I would argue that public health also comes, it doesn't just come from the work of engineers and physicians and other professionals. It comes from popular movements, maybe such as the one you've been having here in Madison. So that brings me to the topic of environmental justice. And I brought this picture, which was taken in Warren County, North Carolina in 1982, because this event is often called the birth of the environmental justice movement in the United States. In 1978, a toxic waste management company decided to save a little money, and they dumped thousands of gallons of polychlorinated biphenyl esters, PCBs, a cancer-causing chemical, on roadsides in central North Carolina. And in 1982, the state decided that the best place to dig up the soil, which it needed to be remediated, it was a public health hazard, the best place to put all the contaminated soil would be in Warren County. Now, if those demographers here might know from the map of North Carolina that Warren County has the largest % African American population in the state, about 65%. And the people of Warren County invented the term environmental racism to describe the choice of their county. It wasn't because of the geologic formations. It wasn't because of the proximity to transportation routes. It was basically because of the lack of political power of the population there. And so this is a movement that has come together, and it represents the legacy of the civil rights movement and the environmental movement. And environmental justice activists around the country and in other countries have charged academics with helping them to conduct research that addresses things that have not been taken up, problems that haven't been taken up by industry researchers or government researchers or academics. So the research questions have come often from the people who actually experience the problems. And they turn out to be different questions than those that have been addressed in the past often. So what I want to point out is that environmental injustice is an everyday part of all of our lives. We all benefit every day from environmental injustice. When we drive a car or consume something that was transported by a truck or a train or a plane, we are benefiting from the fact that we don't live next to where the oil was extracted from the ground, or where it was refined and the gasoline was produced, or where the asphalt plant was that created the material that paved the road. Same for when we heat our homes as far as oil. Our food is produced increasingly in industrial methods that pollute, and we don't live next to those places. It's harvested by farm workers who work in brutal conditions and who suffer the health consequences. And we don't have to deal with that ourselves. When we throw our trash away in the garbage, when we flush our toilet, we don't have to worry about where that goes. We don't live with that, but someone does. And so in these ways, everything we do, we're contributing to this system of injustice in which some people benefit from avoiding the negative consequences of our daily activities that other people have to live with. And that's how I would define environmental injustice. So what I'd like to do is go through a few examples of topics that I've worked on. So this is kind of my personal story rather than based on a review of the literature, which you would have to do if you were a graduate student. But hopefully so it's a sort of case study, but I hope it'll be of some interest. But they're all issues that have to do with some population benefiting at the expense of others. So I'm going to talk about energy, and I'm going to talk about waste, and I'm going to talk about agriculture, those three areas. And I'll observe that they're all about health and environmental health, but none of them are in a health department. And I would argue that a lot of what determines the health of a population is not in the health department. It's in energy, it's in environment, it's in industry, it's in labor, it's in education, and other parts of the way we divide up our system. So just a few pictures here of a community that I just started working with in Baton Rouge that lives on the border fence line of the ExxonMobil refinery in Baton Rouge. This is the Estruma community. It's almost 100% African American. This refinery reports to the EPA on average over one accident per day on an annualized basis that results in exceedances of their emissions. The refinery was started in 1909. I met with residents in a home. The front windows had been blown out by an explosion. and the residents had been evacuated and hosed off at the emergency room, as though they had been workers in a hazardous plant, but these were the neighboring residents. And the government of Louisiana is fully complicit in this. The Department of Environmental Quality, which is supposed to regulate these things, is very close with ExxonMobil and the other big oil companies. They're along the Mississippi corridor, and the companies have their PR system, not only for the government and for the general public, but for the residents of this neighborhood that live every day with the pollutants. And we're just actually working on a new community-based participatory research project with this community. But then I also wanted to talk about another source of energy, which is nuclear power, in part because Fukushima is in the news, and the meltdown and the waste pool accidents there, and also because this is, it's at this day, March 30th, in 1979, that the reactor at 3 Mile Island was melting down. And this was one of my early experiences with conducting research in response to community needs, people who had been excluded by government and university researchers. So a few pictures of the area from Bob Del Tredici's book, a fascinating book. He's a photographer and writer who visited this part of Pennsylvania in 1979 in the summer, shortly after the reactor, their Unit 2 reactor was brought under control. And I just wanted you to see how close people live to this plant there. It's a lot more people live near the plant now. It was a farming area, fairly rural. A lot of people did not have high levels of education. But what I learned through the press was that not enough radiation was released to harm anyone. Does this sound familiar? There's been a radiation release, but there's no health concern, right? How many times has that been in the news over the last several weeks? Well, I read scores of affidavits that had been sworn to by local residents that described symptoms that they experienced at the time of the accident. And I met some of the people, and they described burns on their skin, vomiting, hair loss, animal deaths of both pets and livestock. There was a dentist who reported fogging of his film for unexplained reasons. Lots and lots of case reports that sounded like there could have been high levels of radiation, much, much, much higher than what the industry and the government had said. What they told the people there was that they were suffering from mental distress, that it was a sign of psychological instability, that they believed that they were exposed to radiation. And if they continued to complain, maybe it was a sign that they needed help from a mental health professional. But some of them continued to pursue their beliefs that they had been exposed. They talked about the metallic taste in the air. And some of them reported this before they said they had learned that there was an accident even. Well, by the late 1980s, there was a lawsuit. It wasn't certified as a class, but it involved about 2,000 plaintiffs. And I was asked by attorneys for the plaintiffs to review information on cancer incidents around the facility that had been collected by epidemiologists at Columbia University. And at first I asked, well, why would you want me to do that? Because they're great researchers and this was a well-done study. And they said, well, we think there could be something there that hasn't been reported. So I began to look into it. Actually, the first thing I did was I looked at the medical literature on mass hysteria or mass psychogenic illness because I wanted to evaluate whether that seemed plausible, and it didn't. as an explanation for the acute symptoms. But to make a long story short, we conducted a reanalysis of the cancer incidence data. And what we did was we followed the basic design of the original study, which had not been followed entirely, even in the original report. The investigators collected cancer incidence data both before and after the accident. This meant that they could look at the change in incidence following the exposure that they were interested in. So rather than having a comparison group somewhere else that would have had different reporting, for example, they had the same areas exposed all around the plant within 10 miles. And then they had the pre-accident cancer pattern so they could adjust for the geographic variations in cancer that occur all over the country. And what this map and graph shows are the rates of lung cancer after the accident in relation to the estimated strength of the plumes of radiation. There's actually an airport, I don't know if I have a pointer, but just north of the island on the banks of the Susquehanna River, there's an airport. So they had good weather data. And what this map shows is that even adjusting for the pre-accident cancer incidence rates, the lung cancer rates are directly related to the estimates of the strength of the plumes during the accident. And I take this as evidence that the doses were far higher than were reported. And there's some details of this, if any of you are interested, that are interesting in relation to the current events in Fukushima, having to do with the government and industry reporting gamma doses, but not beta doses. And that's a key component because a lot of the gaseous radionuclides that are emitted in a situation like this emit beta radiation, and that's frequently omitted from the estimates that are released. So next I want to talk about waste as another environmental justice issue. This just shows the increasing production of waste in our country. This is municipal solid waste, MSW, and it's a sign when our economy tanks, what happens to our waste production? It goes down. So more and more waste is a sign that our economy is strong. But it's a sign that somebody is living with more and more solid waste. Trucks coming through their neighborhoods, posing traffic problems and risk of injury, diesel fumes, not only from trucks, but from heavy equipment that's used to move the trash. The leachate, which is actually sent to the municipal wastewater treatment system, which I'll get to in a minute. And truly foul odors and gases that are produced by anaerobic decomposition of organic material in these municipal solid waste facilities, such as hydrogen sulfide. So I got involved because of working with communities where these facilities are operated. These pictures were taken in Orange County, North Carolina, right near Chapel Hill, where the university for many decades dumped its waste in an African-American neighborhood on the outskirts of the town. So we've done some participatory studies with landfill communities, but what I want to talk about here is a GIS-based study that was done mostly by doctoral student Jennifer Norton. She spent many hours at the North Carolina Division of Solid Waste abstracting paper records so that she could locate all of the municipal solid waste facilities in the state, which are shown on this map. And then she developed a statistical model using the census data. And here we see the location of non-white population, people of color in the state. And I want you to hang on to the memory of this broad pattern in this map, because I'm not going to show it again, but I'll refer to it later, that people of color are predominantly in the East. But she linked the census data with the Division of Waste Management records and developed a statistical model to predict the presence of landfills in census block groups based on their demographic characteristics, including their population density, because rurality it's a feature. We don't put solid waste landfills and other facilities in the middles of cities. But what this figure shows is that the prevalence of municipal solid waste facilities, or the odds of having a facility, are higher for areas with more people of color, and they're lower for areas with higher housing values, which is not a big surprise, but it hadn't been quantified before. And this was done partly in response to a proposal that was adopted by the North Carolina Environmental Justice Network that no further solid waste facilities be sited in low-income communities of color until wealthy white communities had their share. But there was no way of knowing whether they would have reached their share without these kind of geographic data. And in 2007, under pressure from the EJ Network and other groups in North Carolina, our legislature passed a new solid waste law prohibiting landfills in some areas, and also insisting that environmental justice criteria be taken into account when permits are issued. And the state was immediately sued by waste industries, which had intended to site a number of large facilities in eastern North Carolina. And Jennifer's dissertation research, which was subsequently published in Environmental Health Perspectives, became one of the sources of evidence that the state used to defend their new solid waste law. So we felt good about the way her research was used. Another type of waste that comes from cities is as sludge. Cities have to clean water that goes down toilets and drains and comes from industries that feed into the sewer system. And they're required to clean the water before it's discharged to a river or a lake. And what's left is sludge that contains all the contaminants and the pollutants. Some sludge is landfilled, some sludge is incinerated, but most of it is spread on farmland in rural areas. And people live near, on the borders of these fields. And in many places they have reported getting sick from these types of activities. This is actually a neighborhood where we worked in this photograph, and here are some of the homes nearby. And so this is another environmental justice issue that's unseen by most people who use sewer systems. But it exists, and we're pursuing right now some research into the kinds of symptoms experienced by people who live next to these fields. But I want to talk more about another issue in agriculture, which is industrial animal production. This is a topic that was introduced to me by people in eastern North Carolina who recalled the Warren County landfill and said that the presence of industrial swine operations in black communities was another example of environmental racism. And so hogs are no longer, most of them, grown on the ground. They're grown on large buildings with slats to let the waste through, the feed, other material from the pigs, the dander, and so on. And it's flushed into giant open pits. And some of these facilities are very close to homes. You can see here in the upper right of this photograph a home that's just a few hundred feet from what could be a couple of thousand hogs and a big open pit of fecal waste. A close-up of the waste being flushed into the pit. And the waste is then sprayed onto land, which is a very effective way of aerosolizing the waste. It includes endotoxins, ammonia, hydrogen sulfide, a whole array of bioaerosols that pose a threat to the respiratory system. Here's a picture that was just taken a few months ago. I'm not talking about something in the distant past. So we not only have spraying in the rain, which is illegal, but there has almost no capacity for the state to enforce these regulations because the Department of Environment has such a small staff to do so. But we have carcass disposal problems. As you can see in there in the foreground, where are the permitted operations? If you remember the map from before, it's in what we call the Black Belt. This is the area of the state that up until the middle 1800s was the location of slave plantations, and it's still home to almost all rural African Americans in North Carolina and really the whole United States, the Black Belt that runs through the South. And they're largely the descendants of the African slaves that were imported by the British up until the early 1800s. So what I want to talk about very briefly is a methodologic issue, because I'm going to talk about a particular study. We've done several studies around the hog operations, and I want to talk about a panel study design. Epidemiologists are obsessed with experimental design. And I think, some sociologists probably are, right? And lots of fields. Experimental design is extremely powerful. But the point of experimental design is to hold everything constant except one factor and evaluate the influence of that one factor. So in epidemiology, the clinical trial is usually used. In agriculture, agriculture is a very important origin of thinking about experimental design in terms of experimental plots and so on. But the reason I bring it up here, I bring it up for several reasons. First is to talk about, despite its strength, it also has real poverty because the experiment as a method removes all context. Where the exposures come from, why they're there, who's exposed, who's not exposed, who benefits from exposure, none of those questions are accessible through an experiment. Yet the experiment is a very powerful tool. So one of the things is it's hard with any study of a putative hazard. You can't conduct an experiment. It's unethical to expose people to something that would make them sick. You can only do experiments on things that are either innocuous or that might make you better. So the panel study design is helpful because in it we have repeat measures over time on a person. So rather than comparing an exposed group to an unexposed group, we compare people during exposed times to themselves during unexposed times. And all the background factors, their genetics, their diet, their medical history, their age, their race, their sex, their psychological states, essentially, those are all held constant because we're comparing each person to her or himself at a different point in time. So we developed this in the context of the Community Health Effects of Industrial Hog Operations study, which was led by Concerned Citizens of Tillery, a social justice organization in eastern North Carolina. And one of the advantages of this study design is that you collect lots of measurements on each person. So your sample size in terms of number of people doesn't have to be as large. But it requires a lot of contact between the researchers and the participants. And that contact was actually seen as an advantage by the Concerned Citizens of Tillery because they're working to organize people who are exposed to these problems. And it gives them more opportunity for education and for people to become involved. So we had training sessions, and this was a real collaboration between a large group of us at the university and the community organizers. And people used diaries. They learned how to measure their blood pressure and use a peak flow meter. And they were followed for about 2 weeks. We studied 16 neighborhoods and quite a few physical symptoms as well as aspects of quality of life. Remember, health is not merely the absence of disease. We measured air pollution at a central location in each neighborhood, and it's important to remember that we can only study acute effects with this design. We couldn't study cardiovascular disease or cancer or anything that would take a long time to manifest itself, and that once you have it, it doesn't go away. These are the tools that were used by the study participants: a diary. They collected saliva in the tubes. They measured their blood pressure. They measured their peak flow. We're still doing some of the analyses, but we have quite a few that have been done already. This is the monitoring trailer. We tried to disguise it, but the stuff sticking up out of the top was a dead giveaway. And I'll tell you that in many of the communities, the participants came to us after about the first week of the study, and they said, "This is wonderful. The odor's been so much better ever since you brought the trailer." And we do believe that in many of the communities, the sprayers were turned off, and the flushing of the waste was reduced in order to reduce the emissions, because no industry likes to be monitored when you might find that they're doing something wrong. And so I'll just share a few results from the measurements that these people made themselves and that we made at the monitoring trailer. So basically, people sat outside for 10 minutes twice a day. And what we looked at in these analyses on this slide were the relationship between acute eye irritation, which was one of the many symptoms they reported, and levels of hydrogen sulfide and particulate matter measured at the trailer at a central location, and also the odor they reported in the 10 minutes. And what this shows is that for every part per billion increase in hydrogen sulfide, which ranged in our study, most of the measurements were 0, because hydrogen sulfide is not a ubiquitous air pollutant. But it reached the detection threshold of the instrument was 2 ppb. It reached over 90 ppb in some communities at some times. But comparing the acute eye irritation reports in the exposed and the unexposed period, for every ppb increase, the log odds of having acute eye irritation, according to the diary, went up 0.15. It's an odds ratio of about 1.16, or about 16% per ppb, which is really big. It was also related to particulate matter less than 10 microns in aerodynamic diameter, PM10, and to hog odor that they rated on a 10-point scale. We have a lot of other assessments. I won't show those. We also looked at some symptoms that were where the participants were asked over the last 12 hours. In other words, since the last diary entry, did you have difficulty breathing? And hydrogen sulfide was also related to reports of difficulty breathing, about a 39% increase for every ppb. And hog odor was also related. In these models, PM10 was not, or only to a very small degree related. We also, in another study, looked at some mental health outcomes, and this was a question about whether people felt stressed. And hydrogen sulfide, as well as semi-volatile particulate matter, which contains a strong component of ammonia, were both related to people's feeling stressed, as well as hog odor. We also worked with some anthropologists who did qualitative interviews with the same population, and here are a few quotes from their interviews. "The odor is sickening. It gets in our house, in our car. I'm self-conscious, angry. I had a rose garden. Do you see those weeds there? I haven't done it for the past few years. We can't go outside, such disgusting odor." So here people are being told, if they have a doctor and they go to the clinic, that they're supposed to exercise to reduce their obesity and to improve their cardiovascular health. But they can't go outside. They can't have their family members over. Their children are mocked at school for smelling like swine waste. This is what health is about, not just disease. And look how close people live. to these waste lagoons and the confinements that blow out the dusts and gases. So one solution that the engineers have is they think, well, the problem for these hog operations is that we just need to cover the waste pits and harvest methane so we can generate electricity. And unfortunately, some of the mainstream environmental groups have bought this and they're supporting this. And here's a picture of a covered lagoon that's producing methane for energy. But the problem is in eastern North Carolina, many of these confined animal feeding operations are in floodplains. And if you cover the pits and get the power companies invested in this, it's going to be hard to remove them from the floodplains. And we periodically get storms that it doesn't matter if the lagoon is covered or not. The waste is flushed out into the local communities. I won't talk about antibiotic resistance, another huge problem with these facilities because they use antibiotics in the feed to promote growth. But this is Madison, Wisconsin. Oh, no, let's see. It's Tillery, North Carolina. And this is what people are brought to everywhere when there's injustice, is to protest. So, you know, the activists made postcards. North Carolina's vacation land. Tourist industry is big in North Carolina. They didn't like this. Here, just a few years ago, I know Jess knows Gary Grant, who's in the baseball cap in the background of this picture, and other Eastern North Carolina residents at the legislature. They set up a mock hog operation. They brought a 50-gallon drum of hog waste. As they were emptying it into the pool, the kiddie pool there, which was their mock waste lagoon, the Capitol Police told them that they would be subject to arrest if they spilled one drop, because it would cost thousands of dollars for toxic waste cleanup. And the community members said, well, you told us it was organic fertilizer in our communities, but now when we bring it to Raleigh, it's toxic waste. But really all over the country, rural activists have become involved in protesting confined animal feeding operations. And here are some pictures from different places where the movement has taken hold. So what I want to end with is a discussion back of our role here at the university. And this is the cover of the November-December 2010 issue of Academe, the magazine of the American Association of University Professors, which is open to graduate students and teaching assistants and research assistants. If I can make a plug for that. And AAUP right now is making a big push to call into question the ability of our universities to serve the public interest as we become more and more beholden to corporate interests and to government agencies that are very strongly aligned with those interests. When we released the results of our first study of the symptoms of neighbors of hog operations, this was a cross-sectional study that we did a little over 10 years ago. The North Carolina Pork Council used the state's public records statute to get copies of all my emails, which I understand is an issue here in Madison right now. They wanted the maps of where the people in the study lived. They wanted all the records, and the University of North Carolina administration refused to protect those records, despite the fact that people live in areas that are where they really could be threatened by the pork industry. That is, well, I'll just quote a woman that I met when we were starting that study. She told me that if we came to do the survey in her neighborhood, we better finish the first day. She said, you won't be able to come back. The sheriff's department is in with the hog industry. The sheriffs raise hogs. They protect the industry. She said, if you break down on the road, don't call the sheriff's department. And this is a woman who carried a pistol in her pickup truck because she knew someone who had been murdered that she felt was tied to the industry. People have told us about job loss and about legal threats when they complain about the industry. So the university, in refusing to protect these records, is doing exactly what IRBs all over the country are not supposed to do. You're at utmost, you are supposed to do anything you can to protect research participants from harm. And I learned, well, why wouldn't the university protect the records? Well, they said the law doesn't protect the records. You have to follow the law. And it was only later I found out that the pork industry had an executive on the UNC Board of Governors. The lead university attorney was a personal friend of the Pork Council's attorney. There are legislators that vote on the university budget, that raise hogs, and that get large campaign contributions from agribusiness. This is the conflicted university. And this is where, I mean, I'm guessing, of course, it wouldn't happen here at the University of Wisconsin at Madison, renowned for its progressive politics. But at many other universities, things like this can happen, and I'm afraid will continue to happen as our universities become more captured by industry and the government agencies that often are running interference for industry. So this makes it even more important for us to be very clear about our role, or our potential role, in social justice movements and environmental justice in particular, and trying to apply our research in a way that can help protect people who don't have other protections, but really that protects us all, because I think in energy, in agriculture, in waste, these are all things that we are poisoning our planet. And if the people who are most directly impacted can help change that, it will help all of us, even those of us who are not directly impacted over the long run. So that's really the strength of the environmental justice movement. And so that's a few examples of issues that I've been involved in, and I hope that that would provide some interesting thoughts about possibilities here. So thank you.